Good day, sir. I am Nicole Garcia from BSN 2C and from Group 5. And for today, I will be performing the return demonstration for home visit with bag technique. So the purpose of home visit is first to assess the family's living condition. Next is to educate the family. Next is to prevent the spread of infection, to provide supplemental interventions, and to give the family access to health resources in the community. So first, for the first phase is the pre-visit phase. So first is contact the family and determine whether they are willing for a home visit. And next is to assess if the family is willing, and if they are, and then appoint an appointment for or a schedule for a home visit. The next is formulate a plan for the home visit. So what are the goals and objectives? And then next is to check the content of the nursing bag or the public nursing bag, and the other articles that will be used, and then inform other members of the health team, for example the other barangay health workers, the barangay captain, or if the schedule allows, then have a buddy system if possible. Then next, for the in-home phase, first is the initiation. So first is knock, so or ring the doorbell, then introduce self, so or identify self. So for example, good morning po, ako po si Nicole from the barangay po, nurse po from the barangay. And then next, if the family allowed you to enter the house, then acknowledge all of the family members through greeting them and introduce self and the agency. So for example, good morning po, ako po si Nicole from the barangay. And then next, observe the environment for your own safety. And then if you have seen that the environment is safe, then sit if the family directs you to sit, or ask the family or direct the family to be seated. Then next is to establish rapport, of course, with the necessary nurse-patient interaction. And then next is to state the purpose of the visit and the source of information. So why you are visiting the home, and why or how you have gathered this information. So the principles of bag technique are the following. It should help in infection control. It allows the nurse to give care efficiently. It should not take away the attention of the nurse from the patient and the family. And it may be performed in a different way. So in the procedure, first is upon arriving, place the bag of the nursing bag on a flat surface or a table. But first, place the paper lining with the folded part out, or folded part for the clean side out. And then place the bag and the straps underneath the bag. And then if there are no faucets available, then ask the family for a glass of water or a basin of water, and it should be placed outside the work area. And then after that, open the nursing bag, and then take the plastic linen and place it on the work area with the folded part out or the clean side out. And then next is take out the hand towel, the soap, and the apron. So perform hand washing. Ask the if there are no faucets available, then ask the so assuming that I've gotten soap, perform the proper way of hand washing, and then ask the family to pour the water, and then wipe with the hands with dry towel, and then since the towel it can be placed in a different plastic bag. So it should also be outside the work area. And then next is to put on the apron with the right side out and the wrong side up inside. So and then tie the apron properly. And then put out the things that will be needed for the care to be provided. So of course, most probably the cotton balls, the dry and wet cotton balls, the antiseptic solution, the micropore tape, the kidney basin, the thermometer, the pulse oximeter. So the BP app should not be placed inside the nursing bag. And then next is to place the waste paper bag outside the work area. And then close the bag, and then perform the nursing care or treatment that will be that are required for the patient or the family. And then if the nursing care or treatment is already done, then clean and wash or sanitize the reusable items. So with the proper sanitizing practices. So for example, these materials, and then after doing that, after sanitizing everything, do proper hand washing again, and then open the bag, and then put all the articles used that have already been sanitized, and then also this and then remove the apron away from the body, so the soiled part should be folded inside, and the clean or the clean or the wrong side should be folded outside. And then fold the linen, fold the plastic lining, and place it in the bag, and then close the bag. And then throw this and this the other soiled materials, and discard it properly. And then after that, then the continuation of the home visit must be performed. So first is to do the continuation of the implementation. So conduct the physical examination, the other physical care needed, and other diagnostic procedures, or if if it is it can be done and it is available for the patients, but this can also be done during the bag technique. And then next is of course, do not forget to perform health teaching, as it is one of the important purposes of home visit. And then if there are services that cannot be done or performed during the home visit, then advise the family to, or refer the family to other healthcare facilities. And then of course, summarize everything and evaluate with the family all of the procedures done during the home visit. So of course, during the termination, summarize with the family all of the procedures that are all of the happenings during the home visit, and set the appointment for the following visits or the follow-up visits, and then record or document all of the findings, and thank the family for their cooperation, for their time and for their willingness for home visit, and then return to the health facility. So for the post-visit phase, everything that happened during the home visit must be documented and recorded, and a referral should be made if needed. And if there are any follow-up visits, then plan it for the next home visit. So that's all po for my return